Welcome, I'm Misty Bohnert, Chair and Assistant Professor in the Department of Kinesiology and Sport. In this video, we will look at how to conduct an assessment that accurately measures a person's level of fitness. There is often a misunderstanding of the true purpose and end goal when participating in fitness assessment. The benefits range from identifying the individual's current health status and physical strengths and weaknesses to helping the individual identify their risks for certain diseases. However, many individuals focus solely on rushing through the assessment because they do not perceive it as an enjoyable process. For accurate assessment results that truly benefit the participant, it is important that the measurement protocols and techniques suggested are closely followed. Before participating in assessment, thoroughly review the instructions and gather any necessary equipment. Consider the space and time that may be needed to complete each assessment. Prepare for the assessment by getting plenty of rest and being properly hydrated and performing sufficient practice or warm-up exercises. Once testing begins, do not rush through the assessment or compromise form to ensure reliable and valid results. Also, it is helpful to have another person available who can assist practically and/or visually with portions of the assessment. Each individual should also consider current health status, including any recent or past injuries that may interfere with their ability to perform movements as suggested. A series of tests will be used to assess the components of fitness related to cardiorespiratory endurance, muscular strength and endurance, flexibility, and body composition. For best results, consider the sequence of tests and provide sufficient recovery time between each individual assessment performed. Each assessment will have a list of specific instructions to follow. Closely following these instructions will help ensure accurate and reliable data. The assessment used for cardiorespiratory endurance is the 1.5-mile run-walk test. A running track or course that is flat and provides exact measurement of up to 1.5 miles should be used. If needed, you may use a treadmill. Also, keep in mind that you may run-walk, covering the distance as fast as possible without overexerting yourself. Use a stopwatch or timer that records split time in minutes and seconds, or have someone assist who will record your finish time in minutes and seconds. This will allow you the opportunity to cool down after the test by walking or jogging slowly for about 5 minutes. For best results, do not do any strenuous weight training within 48 hours of any muscular strength and endurance assessment. Each assessment has specific instructions that should be followed, and ratings for the test may be based on gender. However, individuals should choose the technique most appropriate for increasing their level of strength and endurance, regardless of sex. Movements assessing muscular strength and endurance should be performed according to instructions. Individuals should maintain good form and a steady pace with each movement. Attempt a few movements in front of a mirror or request the help of a partner who can visually assist you. If an individual begins to demonstrate incorrect form or a drop-in pace, they should stop the assessment. Prior to flexibility assessment, warm up your muscles with low-intensity dynamic activities such as walking or easy jogging. Movements during the flexibility assessment should be performed in a slow, controlled manner. You can use a mirror to perform visual comparisons when assessing joint range of motion. Several methods will be used to help an individual best assess body composition. Body mass index or BMI should be used as a baseline, as only height and weight are assessed. Additionally, it is important to understand correct methods for each assessment and how to interpret data. Equipment needed to assess body composition is a weight scale, a tape measure, or other means of measuring height. Be sure the weight scale has been calibrated and/or is in working condition. One technique to check for accuracy is to gently place a 2 to 5 pound hand weight on the scale. A soft, pliable tape measure, such as one that you would buy at any fabric store, is the best to use, but any types of tape measures can be used. The U.S. Navy method uses site-specific circumferences, measured in inches to determine body fat percentage. Circumference sites are gender-specific. Carefully review instructions using the correct technique and avoiding improper placement or measurement of excess fabric. Use a calculator for accurate results. Individuals should analyze data carefully and be able to interpret results, considering the possibility for errors. Information gathered during assessment should then be used to set goals and develop a complete fitness program that will use the FIT VP principle and considers all health-related components of fitness. Fitness assessment can help in the educational journey towards optimal health, especially when an emphasis is placed on the importance of using accurate measurement protocols and techniques for valid results. To learn more, look for our other videos on fitness assessment.